Implant is essentially it's like having an artificial tooth root put back into your mouth, that which I can attach a new crown onto it. So it feels and functions exactly like a natural tooth. It's not something that you have to take in and out to clean. It's not something that you have to worry about moving when you're trying to chew. So if you want to eat your raw vegetables and your steaks and your salads and your whatever food you want to have, you're not restricted socially. You're not restricted at home. You know that you can have a good diet. You aren't going to have to make all of your choices based on foods that you can or can't eat. I've had patients who have changed their hairstyles afterwards. They've started dating again. They get a new job, all of a sudden, they're interviewing and changing careers. It's transformative. It changes the way they feel about themselves. It changes the way others look at them. And they know this, and it's wonderful. I think what makes the implant experience unique here is that from start to finish, I take care of everything. So from the surgery to the bone grafting, to the placement of the implant, to the restorative side, putting the crown on it, from A to Z, you're here. You're here with your team. You're here with me. And we're guiding you through the process. And so there isn't a lot of having to make appointments across town or, traveling somewhere else or having to coordinate care. None of that is an issue. That all goes away. So it becomes very seamless and very comfortable. So dental implants are one of my favorite parts of my entire practice. I focus on dental implant surgeries, and that's just something that has brought me a lot of joy, a lot of additional training. I have been doing dental implants for my entire practice as far as restoring them, but about 15, 17 years ago, I decided that I wanted to also be a placing dentist. So I delved into it with both feet. Tons of training, tons of additional training, hundreds and hundreds of hours of training. And it's been a journey, and it's a constant learning process. It's probably what I spend the majority of my continuing education hours on every year. Lots of time spent just keeping up with new techniques, surgery-wise, but also restorative-wise. The dental industry is absolutely changing rapidly right now, especially with digital workflows. And it's exciting, it's fun, it keeps me really engaged in dentistry, and it also is just such a fabulous service for patients. Not having to worry about going without teeth now if they have to have an accident or an injury, or they lose a tooth for any reason whatsoever, they can have a natural tooth replacement that is very, very stable and feels normal. They can chew normally. And it's such a streamlined process now for us. I do all my own surgeries. I do have a team of specialists that I will work with if there is a complex case, and we do that as well sometimes because sometimes patients have inadequate bone maybe, or there might be some special circumstance where they need additional treatment. And so I will be kind of like the quarterback for that team. And so I'm constantly involved with it, but we do have specialists that will work with us. And that's fantastic, and patients love that. But it is one of the more transformative procedures that I feel like we do. A lot of full arch hybrid type of prostheses, which are the teeth in a day. You might see that type of thing advertised. People come in and they're like, tell me about how do people come in the office and leave the same day with new teeth? Like, what is that about? And so essentially it is exactly that. We are able to take out bad or diseased teeth and then provide them with a new set of teeth that same day that's actually attached to their jawbone, and they can eat and function with a whole new lease on life.